Welcome, friends. This is Dr. Daniel Altschuler, and he is going to chat with us about his vast experience as a doctor of Chinese medicine, as a professor, as a specialist in all kinds of areas, including back pain. And I'm not sure where the interview will take us, but I'm going to take as much information from his vast amount of knowledge as possible. So, Mr. Daniel, please take it away.
Thank you, John. I appreciate you inviting me in for this interview. I look forward to answering whatever questions come through, and we'll see where the conversation takes us.
How did you come to practice and study this medicine and this area of knowledge?
So I was intrigued by Asian philosophy and Asian thought back in middle school, I believe. There was a TV series called Shogun. I remember watching that when I can't remember exactly, but I think I was maybe middle school, early high school, and just really beautiful images, and the whole thing intrigued me, and I had never really been exposed to Asian life or thought or the aesthetics of it at all. And so that took me in my suburban upbringing to the only access I had to Asian culture, which was a local martial arts studio, Tang Sudo, run by a Korean sixth Dan master. He was quite an amazing person and really shaped a lot of my life, and especially in those years. And he also had a spiritual quality to him as well. And so that took me through high school and into college. And Alan Watts. Oh yeah. I guess not the only person who was inspired by his books, but Alan Watts and Zen and the Art of Swordsmanship were the only two books in the occult section in my bookstore, local bookstore.
The occult section.
So that also fed me a little bit. And the back of Alan Watts' books had the technical terms were written in handwritten Japanese kanji, or Chinese characters. And I really thought the magic of what was in there, it was necessary to understand those characters, to understand the magic of the art. And so that took me into college. I studied Japanese language, which brought me into Japanese culture and philosophy as a major. That took me through graduate school, which took me to Taiwan. And while I was in Taiwan, doing some advanced language studies and some Taiji Chuan, then I decided I wanted to just learn a little acupuncture. I knew about as much of Chinese medicine as any American. I thought acupuncture was just, something easy and fun to learn, and it was the flip side of martial arts, and also very compatible. I really liked the idea of having martial arts and medical healing as a study to learn together.
Me too.
So right, and so I had some extra time there, and I shopped around for a teacher. I didn't really know what I was doing, and I didn't really care. It wasn't my profession. It wasn't my intended profession. I thought it would be just fun to learn a little bit. And after looking around for interviewed a few teachers, I came into Dr. Li Zhengyu's clinic, and he was just immediately welcomed me. He knew I could speak a little Chinese, and I could read a lot more, and so he was very happy to meet me, and promptly told me to leave the clinic and go to the bookstore next door and buy this book and that book. And,
oh, great.
And I started reading and going to the clinic a little bit, more reading, less clinic, and then more reading and more clinic, and then that became my entire day. in my entire week. I was there 7 days a week. And the years passed, and I was there 5 years. And I decided that maybe I should get my license in that. So I took the boards in the U.S. And then I still had 10 more years in Taiwan before I left. So
wow.
It just became a 15-year life change, while I was in Taiwan. And then now back in the States, I've been here 15, 16 years now, doing teaching and clinicking.
Right.
So that's my resume.
And for everyone interested, in the information section down below, I'll include appropriate links to your clinic. And within your clinic, do you happen to have certain specialties or your areas of greatest interest within the spectrum of medicine?
My specialties, I guess I could say they're cancer and autoimmune disease.
Mm-hmm.
And I'm a little hesitant to say that because I'm a general clinician, so
Sure.
I see whatever walks in the door. It could be, back pain or gynecology or neurological trauma,
Right.
anything. My teacher is a bit of a, I shouldn't say a bit of. He does everything in an amazing way. But one of the things that he has done, especially when I was at his clinic, he was very passionate about neurological issues, which he did some research with the neuroscientists, neurosurgeons, local neurosurgeons, which are some of the top in the world, on regenerating the spinal cord after trauma. So quadriplegics and so forth. And so he was working on this for a long time before, but he had this research project to validate or to put numbers, statistics on the effect of his treatments. And
Still cutting edge medicine.
It was amazing stuff, and this is like the beginning of stem cell research as well. And these neurosurgeons were also the forefront of stem cell research, before other people were doing it. They were doing it. So it was really fun. I was a major part of that of that in the clinic and so forth.
Right.
So anyway, so neurological also is something that I have a lot of experience with, although it's not easy. None of these are easy topics or easy things to treat, but.
Right. Well, I feel like that's one of the great gifts of Chinese medicine is that everything relates to everything. And so to say, I only study this piece, it doesn't really work that way. Everything interacts, especially with something as general as back pain or any kind of neurological illness.
It's really true. It's amazing that in Chinese medicine, you can use the same formula for a cold or for back pain.
Right.
Maybe to an outsider, it might be a little laughable that, how could you use the same thing? But actually, if you understand the principles and why it works, it's actually quite profound.
Right.
And so learning a small piece really well can branch out to the whole thing, and then learning the whole thing can also branch to any individual piece of medicine as well. And so it's a pretty cool system of medicine.
I think so too, because of this channel's emphasis upon the study of back pain. Do you have any particular stories or favorite teaching stories that you can share with us?
About back pain?
About back pain, or about, in general, how the nature of health relates across. And so somebody with gynecological issues can develop back pain. A person that has great fatigue can develop back pain. Those kinds of things. Everything interrelates.
Absolutely. Everything is connected. I mean, I don't mean in a spiritual or energetic way. I mean, just viscerally, the connective tissue connects everywhere. A uterus connects to the spine and the ribs and the muscles, the abdominis rectus and other muscles, they connect from the ribs to the pelvis and, all around and in and out. So it's anything can cause pain in all kinds of unpredictable places. And that's one of the reasons why some people will have some pain somewhere and go to 100 doctors of any kind and not get treated well because they don't. And this happens to all of us. I mean, it's not it happens to all of us. But the pain could be coming from some completely unexpected place. Gynecology is a really good example. Having what we call blood stasis in the uterus would be a very easy way to have pain in the lower abdomen,
for sure,
or back, or even in the leg. That's not connected necessarily with the menstrual cycle. Sometimes it is, but it could just be something that's present and undiagnosed. So it can be all kinds of stuff. Absolutely, pericardium. The pericardial muscles or the chest muscles can contract, the diaphragm can contract and then radiate around the back.
Right.
And that's like people who are just nervous or angry at something, the muscles can tighten up and wrap around and become painful in areas, cause sciatica. Yes, absolutely. I'm not sure.
Do you have any, within your own clinical experience, and somebody comes in presenting, for instance, with back pain or something related to that, have you found that there is a consistent problematic thing, maybe even just of our current day, for instance, that the advent of tech neck pain, and people coming, spending too much time on their phone, or something that you've recognized as a common problem?
Yeah, that's a good question. I think, the tech neck thing and all of the problems that people are told might be causing problems are not always the case. Sometimes it's simpler than what people think. I'm trying to sort through my recent patients to kind of think of what might be really common, but in the end, I think we're vertical beings, and the spine, the closer it is to the perfectly upright and perpendicular to the ground, the better, right? And very few of us have good postures, or perfect postures, I should say, right? So we're always a little bit off this way or that way. If you're, if we're slumping or we have a habit of leaning, driving a car a lot. I don't think it's any one thing. It's just living life as a human being on 2 feet instead of 4. I think it just causes, there's always that weak spot, and I think you could read this in any medical textbook. The most common areas of back pain caused by movement or injury, usually L4, L5, S1. Mm-hmm. And the reason is the S1 joint is not movable and L5 is, so it's very easy for the vertebrae to not cooperate with each other and have that come out of place a little bit, or push on the disc, to greater or lesser extent, and then L4 is right in there too. So just bending over without thinking, and usually it's that. Usually people are fine until they just were in a rush to get out the door and picked up the bag in just the right or wrong posture. It's like the physics and the physics of being a lever. That's the weak spot if it's just not done. If it's done just in a right or wrong way, depending on how you look at it.
Right, when that movement goes to that joint instead of through the joint into a structurally stable way.
Absolutely, yeah. And so that's a very common spot. And the other common areas are in the upper back, or between the scapula. And that's not so much. I usually find more and more that's not as much or as common, I should say, at least in my clinic. Vertebral issues, but more the ribs.
Interesting.
And they come out of place through whatever. It could be from a fall or stretching the wrong way or sleeping on the couch without support in your upper back.
Right.
All kinds of stuff, and the ribs just come out just a little bit or a lot. And that's a very common thing. It's not people get worried. I say, "Oh, your ribs out." And they get freak out, but it's just what they're meant to do, actually. But that can be undiagnosed for years actually, and cause headaches, cause back pain up or down, cause pain radiating to the shoulders and so forth.
Right. Is there a simple treatment for that kind of pain?
I mean, there's a lot of ways to reset ribs. I have my way of manipulation. Mm-hmm. I should say manipulation. There's like wording. We have to be careful with wording because scopes of practice require different wording.
That's right.
But chiropractors have their manipulation. Chinese medicine, we have Tui Na, where we do our thing. Mm-hmm. Osteopaths and so forth. Or I guess you can get a really good dancer to tap dance on your back.
I'd like to mention that this channel does not support that particular diagnosis. Those people out there will try it. But for the people listening, for instance, within that particular issue and recommendation, how then would you recommend, just for this rib being out causing spiraling pain through their body, how would somebody go about getting that diagnosed so that they can get a proper treatment? So they don't just go to somebody and say, hey, do this.
Well, I think of all the people that work on the body, all the different modalities, chiropractors definitely hone in on that just as a specialty. That's all they do, or at least that's all usually their reputation is what they're supposed to do. Osteopaths also, work on bone rhythms and bone settings. So and then Chinese medicine, Tui Na is a chiropractic method, as it was in China traditionally, and now in the U.S. it's Tui Na is renamed as chiropractics, but for a Chinese medical practitioner that has trained in Tui Na, it's very similar. But so anybody that's qualified to do that can certainly do that.
Great.
Not sure.
That's one thing I always want to stress to the people watching is make sure that you go to a good practitioner who has training in this thing and doesn't just say, yeah, sure, let's try this thing, because that's when accidents and injuries happen and then everybody gets a bad name.
That's right. Yeah. That's right. And, people, taking a weekend course doesn't mean you're qualified, just even if you have a plaque on the wall. And, of course, so, yeah, you have to do your research, make sure that you have somebody qualified. Chiropractors, there are some awesome chiropractors. I used to avoid chiropractors just for whatever reputation that I thought they have, but in the last few years I've met some really amazing ones, and I do a lot of referrals to
great
to them. So there's you just have to find good people, whatever discipline. That's
what I hear. Yeah, actually, one of the worst injuries I've ever suffered in my life came from a chiropractor. And so I'd gone to several to repair the damage, and the thing that actually healed me was that Qigong practice. And so now I am very leery of recommending it to people where it could sound correct, and that's another reason to have a network of skilled practitioners to refer to each other, because we all know, okay, this person is safe. I can safely send my delicate patient to them and not worry about them being damaged long term.
Yeah, I mean, the idea of referrals is probably an amazing topic to do separately. There's a whole lot of, as a patient, I would say, there's a lot of research and skill you have to accumulate to get a good team around you.
I love that. Yes. Yeah. Next video.
Absolutely.
So the next question then is, since we're talking about the skills that somebody seeking help can acquire to do a better job, one of which is, of course, developing a good medical team around you of referrals and people helping each other to help you feel better. Do you have any recommendations for people just starting that journey of healing? They're discovering that maybe now they have a problem, and maybe they watch this video and they say, oh, I didn't know this was treatable. I just assumed this was the pain that I have every day because that's life. And my mom had it, and my grandmother had it, and do you recommend anything to people just starting that journey so that they get the best results?
So there's a lot of problems that seem to be hopeless or helpless, and often in the clinic, looking at it as a third party, as an experienced practitioner, but also just somebody, looking from the outside in, you can often spot a lot of reasons why that problem may be there. And it could be genetic, of course, but more often, if it's something that, it runs in the family, it could also have just been a habit that you learned from your family, or something else that was derived not from a genetic problem necessarily, but just a lifestyle issue.
Mm-hmm.
In Chinese medicine, we very clearly separate something that is inherited, and we call that Shantian prenatal, or something that occurred through the birth, right? Or before the birth in the womb, and then postnatal Hotian, which is something that occurs once that umbilical cord is cut. It's all on you, kind of thing. And I think that way of looking at it through Chinese medicine as a practitioner, it's really helpful. Even genetic issues can be helped by lifestyle and things that you give it.
That's right.
Maybe I'm going a little bit off topic, but
no, not at all.
The point I want to make is that there's always, at least I as a practitioner, always go by the assumption that everything is treatable, and that's not being kind of a crazy, medical cowboy or anything like that. but I think it's really Chinese medicine really has a lot of answers to things, and if you start off with that open-mindedness and kind of the sense that anything is handleable, any problem is potentially treatable, then I think you're, there's more possibilities that you can approach as a practitioner, right? And not to mislead yourself or a patient. I don't mean to stupidly do that, but even like I was saying, quadriplegics or people with severe nerve damage, if we're talking about back pain. Another reason for back pain also is cancer, especially metastasis to the spine.
Sure.
Or the pelvis, and all of those things have a potential treatment. You can read in classic or modern case studies of masters, China or Taiwan or wherever. Amazing treatments, not miraculous. They're not spiritual treatments. They're really understandable and explainable, and so it's possible. What is it? 11th hour treatments, kind of.
Sure.
That take people from some really odd and difficult place, and then move them into a better place or cured. And sometimes it's not going to be the day after. Maybe it's the month after, or it's a year after. Maybe it's 3 years. Maybe it's 5 years. But so I think I'm going in a lot of different places.
This is good.
So first, I think looking at the patient and their lifestyle, their habits, and helping them learn to be aware of what they do, and then myself as a practitioner trying to treat them, is kind of break down the immensity of the problem into solvable pieces. I think anybody who solves problems, that's the technique to do, right?
Right.
And then just kind of take it step by step and work on it.
That's really important. Yeah, that having a sense of hope and direction at the same time, recognizing that sense of apathy or hopelessness, which is often bestowed upon us by the kind of the current system that takes our feeling of capacity to heal ourselves away, or that something can be done. Everything is in the hands of the gods in white. And if they say, well, nothing can be done, or they kind of shrug and give you an antibiotic or something, and it doesn't help, then people give up. Or maybe they run out of money.
Right.
And that's been a common thing for the people on the internet. I live in a country where healthcare is, people go broke from healthcare all the time. And when you run a free clinic, you see people who have been run through the ringer and they have nothing left. But they worked as long as they could, and then they seek out alternative methods, whatever that illness is. And it is so common that people will get better, and get better in some capacity, depending on what it is and who they are and how hard they work and that kind of thing.
And you have to be willing to do some work.
That's yeah.
You can't just go to the doctor and then go back and not change your own lifestyle.
That's right.
You know, whether it's sleeping on the couch without a pillow behind your back, or losing weight if you need to do that, or whatever. There's but you have to be willing to put in maybe more than half.
That's right.
So
that's right. One of the people that I'm intending to interview is a doctor that I chat with from time to time, who's a back specialist podiatrist, and he will give people new shoes, and their posture shifts, their entire body changes, their digestion shifts, their heart problems change, and just from new shoes. And this is to your point, how everything relates to everything. And
absolutely.
You just have to be able to keep working until you find the thing that helps, because sometimes it is as simple as losing a little weight, and that's something that most people can do, and it's free.
It's free. and actually, I have a story of a patient who's no longer my patient, actually, because she did that work.
That's a good sign.
It was bad for business, but good for her. She saw me quite a lot. She was worked at an office, not because she had to, but she just wanted to do something other than stay at home. She didn't do the money, in other words. She worked at actually a naturopathic clinic, if I remember, and generally pretty good. She had cancer before, but had recovered, and everything was fine. But she came to me for back pain, upper back and shoulder pain, and I would treat her. She'd come in, fairly regularly, and then she finally retired from working and started walking. She lived out over in Redmond area, and so there's a lot of walking trails there. So she just started walking, and she went from maybe no walking, or maybe a mile a day or something, to walking 5 to 8 miles a day.
Wow!
Within a month, she lost, I think it was a month. It wasn't very long. 30 pounds.
That's wonderful.
She wasn't obese or anything like that. I mean, she was. I mean, she didn't. I didn't really feel for her age she had any major weight issues or whatever. But she lost 30 pounds just from walking. All of her back pain went away. I mean, maybe it comes with the weight, but also just moving. That's right. And she said, "I don't need to come anymore." I was like, "All right, awesome for you."
That's the goal.
So yeah, I mean, it was, that was a really amazing. So I tell all my patients that, about her.
I love
that. And that was free, it was free, and it worked. Her method, and she's not the only one that's like this. I've had a lot of patients who try to lose weight or fix whatever they're doing through exercise that they need to do through exercise. Joining these expensive gyms,
right?
And Zumba and CrossFit and blah blah blah, and they're all great. I'm nothing disparaging about them, but nothing seems to work as good as walking.
I found that too. Yeah, and walking well.
Walking well.
That's
yes. Right. Walking mindfully, I should say.
That's right.
And walking well is an art. I think maybe I'd love to hear what you think of walking well is, but I didn't mean to jump on that. But
no, not at all.
But I think for the average person who maybe doesn't have walking as a training, like if you go jogging, you often start to think about what you're doing because it's maybe rigorous, strenuous,
Right.
so you have to prepare and plan and think about it. Different shoes and sparkly spandex or something. But walking is like, hey, I walk to the grocery store every day. What's wrong with that? But
That's right.
you really have to do it mindfully and look at your gait. And we're all right or left-sided, so one of our legs is going to travel a little bit more than the other. And over time, that can create a little bit of a torque or a little bit of a stress or strain in some muscles. And not that you shouldn't walk, without, that's not going to hurt most people. But, if you start to think about it, then your walking can become better and better.
That's right. Yeah. When I spent some time working as a personal trainer, and that has that sort of biomechanical adjustment has threaded its way through my clinic as well, especially with the advent of everyone having a slow motion camera on their phone. Now they can have their partner or somebody film them jogging or walking or doing something, and we can go, oh, see how when you're stepping here, you're stepping too far, so your hips come forward, and your knees lock, and your back arches, and your neck comes forward. And so people have these wobbly walks where you see these waves of motion going through and usually into a joint. And that, of course, causes huge amounts of pain. Yep. And there's some wonderful calculations about the hundreds of pounds of force that accumulate with every step when people step incorrectly in a certain joint. And it just breaks it down over time. And, of course, it hurts, especially if they're walking with their toes out, but their knees are still going forward. And sometimes it's as simple as getting that kind of thing corrected, which, again, it can be free if people do a little self-education or get a little help from somebody. And,
I think that's right on, yeah. Or maybe, orthopedic supports, like
that's right.
Your friend. But I would, for people who are listening and don't know where to start, I would just start with walking. Mm-hmm. And, if you find that the more you walk, the more pain you're in, then be more mindful and get, seek out some help. There's a lot of, people with pediatric, the BMD white coat types. But there's also just a friend, like you said, who can walk next to you. But you have to have an honest one, right?
Right. That's right.
Oh,
you look
hey,
great.
Terribly. That's much more helpful than you're fine. Or somebody who has like a little training, like a trainer or somebody who's been in the biz a little bit and knows body posture.
Right.
And then there are all kinds of movement classes, like what is the class where you kind of work with your neck?
Like Alexander technique, or
Alexander technique, yes, and all kinds of stuff out there.
There is
that, and whether or not that's the answer for you or not, it's like take a class and start thinking. Everybody's got a different perspective, and you just start to be mindful. That's how you get mindful, is through those types of insights.
Well, and speaking of mindful walking and mindfulness in general, I know that you are also an avid meditator, and we know clearly about connections between stress and this kind of process and how it's possible to treat it with any kind of mindful activity like this. Have you seen in your clinic stress reduction helping something like back pain or joint pain in general?
I should tell you, I think meditation actually can cause a lot of back pain if you're not doing very well. It's and this is from personal experience.
Sure.
Both, and we also are friends through the Tai Chi or Tai Chi Chuan connection, and that also personally caused me a lot of back pain. And I can, it's not that those arts are bad for you, but I was bad for myself. And so, I think this was when I was in college. I was doing a lot of Tai Chi and beginner. I was when I had started learning, and I was also continued my Tang Sudo training. Tang Sudo is like a Taekwondo,
right?
Different system, different political system, but same type of techniques. And I started getting some sciatica in my right side. Pretty painful. Sometimes it'd be hard to get out of bed. I was very flexible because I was stretching a lot with all the Korean style kicking, and I could do the splits and kick up my ear or whatever. All that was not a problem. But I kept thinking that the Taekwondo was hurting me, So I backed off of that and I did more Taiji Chuan, because Taiji Chuan has the reputation of being, a magical healer of all sorts. and it wasn't until I went to Taiwan. So this is I've had this for a while, and I wasn't doing any Chinese medicine at that point. I'd seen a couple of Chinese acupuncturists. They didn't really help me very much, to be honest. And so I went to Taiwan. I was to meet the Mr. Liu Shiheng, who became my Taiji teacher there in the Jianmenqing style. And I was only there for a couple days the first time, and he liked to do the standing posture, which is called raised hands. You're on your back foot, all your weight's on your back foot, and your front leg is forward, and the hand that's over that leg is, you're in a posture like this. And so we would do this for a long time on both legs each time. And during that holding time, he came over and adjusted my hip just a little bit, just like that. I don't even know what he did because he was behind me. I kind of felt what he did, and I later kind of got a better idea what he was doing. But he just did that. And right then, not even within a second, but right as he did it, my, 5 years of sciatic back pain went away.
Wow.
And never really came back. It was a little bit weak, and it would come back if I got sick or something like that, because it was a weak spot for a while. But that was it. It just kind of disappeared. And I realized at that moment I was creating that problem myself.
Right.
Because I was doing Taiji incorrectly, and this is kind of, you're going back and forth, left and right, left leg, right leg, back and forth.
Aggravating
so it was almost like a repetitive stress syndrome.
That's right.
That I was self-creating. And I was like, oh man, that was just ridiculous. And I had been to amazing doctors. I've been to doctors that, I don't want to say, but Ivy League hospital, and they took x-rays and MRIs and poked me here and there. And it's like, no, you're fine. There's no arthritis. There's nothing. It's like, you're fine.
Right.
And it's like, it wasn't Taekwondo either. It wasn't the Tang Soo Do. It was
the Taiji. Yeah.
It was the Taiji, and also meditating. If you're meditating and you're not really in a good posture, if you're not thinking about your posture, maybe you're a little bit leaning or a little bit, that could put stress on your back.
That's right.
Doing them correctly may be uncomfortable for a while until your body kind of softens into it, but it should at some point soften in. But if the more you're doing it, the more you're uncomfortable, and you're just kind of toughing it through because you think it's good for you, but then you need somebody to kind of
right
help you out with that, or you need to figure that out.
That's such great advice. Is there a point that you would recommend to people who have been toughing it out, or in that process of practicing, hopefully with the help of an expert, and it's not quite getting better, is there a point that you would recommend, especially if finances are tight, that, okay, I'm going to go get help?
I think any time it's good to get help, honestly. If you're having trouble and you don't really know what's going on, finding some competent help is good. And for me, unless you're screaming in pain and you absolutely need to go to the emergency room, or you need to get some sort of surgical intervention or something, extreme cases. In most all other cases, doing the least least invasive is
right.
better. So there's, people don't know that you don't need a steroid shot. You could probably do acupuncture, right? Or that you don't need you could get maybe chiropractic, but not that chiropractic is not helping you, but maybe the one next door. The same with acupuncture. Maybe that acupuncture is not working for you, but the guy around the corner might. Or,
right.
So in almost all cases, a lot of it is treatable, or even with a herniated disc, somebody who has the right training can do a lot. And so if for the people that don't want to do those things, I shouldn't tell all people not to do them, but for people who are looking for another solution and are not in dire straits,
right.
Or have, of course, a life-threatening emergency or whatever, and finding the least invasive is better.
I agree with that. Yeah, and people
not panicking either, too. I mean, people panic with. Some people are prone to panic when their body goes a little bit off.
Right. Sure. Well, and that goes back to the meditative quality and not letting yourself get freaked out, because that by itself triggers pain syndrome. And
absolutely.
Is there a therapy method that you would recommend avoiding? Because, of course, with any medicine, there's good medicine, and right next to it, of course, there's lots of bad and even dangerous medicine.
I think that's I can't think of that right now. I think it's mostly the quality, not the modality.
Okay.
And different modalities work well for different people. It's I don't I've seen Pilates help a lot of people. I've also seen people come to me with back pain and go, oh yeah, I've been doing Pilates for a year, and yesterday it's a different instructor, and all of a sudden I had back pain.
Right.
So is Pilates good? Is it bad? It's like it's the instructor that was maybe pushed them in the wrong way.
That's right.
Not to pick on Pilates, don't sue me. But I mean, it's true with everything. Like doing martial arts and Tai Chi and meditation. I mean, you could do anything.
That's right.
So it just doing whatever you're doing, just make sure if you whether it's exercise or therapy or I just always come back to being mindful about it.
Mm-hmm.
Doing your due diligence with doing it right.
That's really important. Doing it right, seeking quality, and taking the time to invest yourself in the therapy so that it can work for you.
Or just give it a try for 3-4 weeks.
Right.
I mean, in some ways, that's the best, right? A lot of people will call me for a first visit, and they'll ask me, I say, well, I do acupuncture, I do herbs, you're welcome to do them. And they say, well, if you think it helps. I was like, well, of course I think it helps. I'm not going to tell you it doesn't help. I mean, I'm being, at least I feel I would be honest. If it didn't help, I would say so. I don't know what other people would say. I mean, you have to, whatever it is, you have to try it. And there's also this, in Chinese they call yuan fen, just kind of almost kind of like a fate, right? How things meet and are appropriate or not. So, there are people that come to me and see me for a while and don't get the results they're looking for, and then turn around and go see somebody who just graduated, like maybe a student of mine, and get great results.
Right.
And it's like, I have so many years of experience and they have so many months of experience, but hey, they just did it right,
Yeah.
And that happens,
That's right. Yeah.
I remember when I was a student, I had a couple patients who came to me, and I don't remember what I did or what they were there for, but I did something, and they were like praising me and how wonderful I was, and you're better than that guy, and that guy was one of my idols and mentors. They didn't know that. I was like, oh man, I felt really good, but well, who was I? I was like just this young practitioner. I love you,
Right.
So it's just a matter of it's not random, but it's you have to just kind of try new things and be open-minded.
Right. Well, and sometimes it is that quality that it's not. It's who they are. It's not what they do. That's part of the treatment itself. And so, finding a practitioner that you vibe with, that you have that sense of resonance with, that by itself is part of the healing process.
That's true.
Mm-hmm.
That's true. Yeah.
So then, is there any extra information that you would recommend? So again, for somebody who's out there and you meet them in the grocery store and they, my back hurts, and just in general you say, maybe give this a try. What's the one recommendation you'd offer to them?
Well, Chinese medicine is awesome, so I'm going to plug that. Acupuncture, I would even, for that type of pain, even somebody without very much experience can handle most back pain. It's a very, in most cases, it's fairly treatable. And herbs are also extremely good. I do both acupuncture and herbs. So both of those, either of those, especially both of them together, do a fantastic job of treating pain. Any kind of pain, but back pain especially. So I wholeheartedly recommend looking for a qualified practitioner that can help in Chinese medical modality. And certainly anybody that works on bone structure is going to be helpful. And then be very take one day and think about your day from before you wake up. How you get out of bed, what kind of bed you're in, how you get out of bed, how you put your feet on the ground, how you sit at the breakfast table, how you sit in the car, how long you're in the car.
Right.
All of these things. Sometimes there's just something that is happening in your life that you don't even realize is causing the pain that could be a lot cheaper than going to a practitioner. You just stop doing that.
That's right.
But back pain is it plagues almost, I forget the percentage, but a majority of people have back pain sometime in their life.
That's right.
I forget the numbers. And so it's you probably walk down the street and half of the people that walk by you, a third of the people that walk by you, are in some degree of back pain.
That's right.
More or less, and you don't know it. Maybe they're not. It's not enough that they have to limp, but it's a common problem. And
I think so too.
Yeah, I think instead of just living on some sort of pain meds, just try something.
It is possible to heal.
It is possible to heal. I've treated people. I remember there was a soldier. I think it was the Kosovo War? He was a special forces, I think, and I think he had to pick up like this huge backpack, and his back just actually crushed.
Oh.
It was so heavy, and it actually just kind of sandwiched down.
Gosh.
And he was in incredible pain. He was young. The VA was giving him all these breakthrough meds, really heavy stuff. Don't operate heavy equipment on after you take this kind of drugs. And he came in for acupuncture. That was actually a student clinic, so I was supervising a student doing that. And he came in weekly, and if I remember correctly, after a couple of months, 2-3 months, he didn't have to take his breakthrough meds anymore.
That's amazing.
He still needed other meds, but he needed less meds, and because of student clinic, they would often shift from supervised to supervised. So I've kind of lost track of what happened to him. But even in just 2-3 months, he just improved by that much.
I love that. Yeah, I have lots of those stories also, and it's wonderful to share them because people, they feel hopeless, and there is a way through. And
absolutely,
I am so grateful that you're out there teaching and sharing and being as open as you are with your experience and your knowledge. And I think that everybody out there will gain a lot from this deep wisdom from your experience. And
well, I mean, thank you, John, and I do think that what is being taught, like the qigong that you're teaching, is also really amazing, that's the kind of work that helps the muscles relax and the back stretch.
Yeah.
So I should probably mention that as well. It's an incredible system, and it's not going to work in a day.
That's right. Mm-hmm. Thank you. Gosh, I'm so happy to have you here. And maybe in the future we can get together and do more.
I would love to.
Yay.
I would love to.
And again, for anybody interested, the information for contacting Daniel will be down below. And I highly recommend getting in touch with him if you're in need of help. He is a wonderful inspiration to everybody in the medical community, which is the reason why I wanted to start with him.
Thank you, John.
Mm-hmm.
You're awesome.
Thanks so much.